I feel like often doctors have this limited idea of what trans is and what hormones and surgery mean, and they just expect you to like want the full package, like all of the things all inclusive, and it could be difficult to be like, no, I just want this, but like I'm okay with like not having surgeries, or I just want a surgery but I don't necessarily want hormones. So like I feel really lucky because I feel like I have a doctor who I can explain that to and who gets it and can explain things to me, but yeah, I feel like that's not the norm.
If you have any suggestions for folks who are interested in going on hormones, like
yeah, so I think if anyone is thinking about going on hormones or doing any changes to your bodies, if you don't have a good family doctor that you feel comfortable discussing these topics with, you might just have to change your doctor completely, or if you can just like find some resources, like I said, Rainbow Health Ontario is really good website, and you can just like bring that information to your doctor, or just get a new doctor, which is like what I did. So it's important that you just have to take the initiative and really push for the things that you want.
Doctors also don't have like a baseline of education. Like there's no extensive training when you go through medical school about trans health. I've heard a couple nurses and my doctor explain it as there's like a 1-day training, and I think it's only like half a day around like LGBTQ in general. So it's not even like trans specific. It's like queer, trans, like often they have things in there that are just kind of like how to like interact with people, you know, like not like what are specific health concerns of queer people, what are specific health concerns of trans people. So you really have to seek out that education on your own. So either like being listed on Rainbow Health, or like I know Planned Parenthood is really good because I mean you can only access stuff from their resources from there until you're 30. But they have a good list of folks to transition their clients to when they turn 30, so they're not just gonna like leave you. So even if you can't get into Planned Parenthood because it's full or because you're too old, you can ask for their resources. I don't think it's not the majority, and because there's such a high demand and so few doctors, people are often overworked, and so it can be difficult to get in. There's probably gonna be a waiting list. Like you're probably gonna have, even if you find someone who's really amazing, it's probably going to be a wait before you can get in, just like you were saying.
But then just call them today and get your name on the list. Another thing that I just realized is that I'm also very lucky that I have access to a car and able to travel to Toronto to see this doctor. Even just a couple of years ago, I would not even think that this is something that I can do. Like it's not an option because it's not easy to travel to a whole different city.
Yeah, I mean that's huge. Like to think that like you can't get prescribed hormones in Brantford, and if you don't have the capacity to leave Brantford for a doctor's appointment, like also like with work, right? Like I'm privileged in the sense that I can just take a day off work to go to Toronto for a doctor's appointment. I can go all the way to Toronto for a 1 hour's doctor's appointment. Like I think it just shows like the lack of access to trans-specific healthcare that people have to leave. Yeah, I mean, if you can't, then you just don't have access.
For me, what's really important and made my life changed in this positive light is because of the people that I have in my life. Like, I think community support is also a huge thing that has impacted me in so many ways. Like if it wasn't for you, I wouldn't have even know that this is an option for me. So I remember right before I started going on T, but like just while I was in that process of like getting my blood tests and everything, there were so many people offered like their support because they've gone through it, and just having that wonderful support from the people in my life has just been phenomenal.
Yeah, I agree. It's really important.
Because it's a huge thing. It's a big change. I think just knowing that there are people around me that I can reach out to has has been really helpful. And I also really just appreciate that we can go through this together. 'Cause
Yeah, that's
it's
really,
really
nice too.
nice.
Even if you have supportive people, and like we have a lot of supportive people, it's nice to have folks who are like are going through that as well, and to be able to like compare and like talk about things with, do things like this.
Yeah.
Yeah.
Do you feel like we bonded?
I think we did. I totally think we did. We were already pretty bonded, but I just think it was like one more thing where we were like, yeah, this is fun. This is like a fun little adventure for the both of us.
You're like my lifelong buddy now.
Oh, tea buddy.
Oh, tea buddy.